On behalf of the Integrated Health and Wellbeing Council, I welcome all of you to this breast cancer awareness series supported by Roche. I am your host, Dr. Behjat, and today we will be discussing about breast cancer signs and symptoms, risk factors, management, and patient perspectives. And to discuss about this very critical issue, we have with us a very special guest. I have with me Dr. Bharat A. Vaswani, who's a senior consultant, medical oncologist, and hematologist at Yashoda Hospitals, Secunderabad. Welcome to the discussion, Dr. Bharat.
Good evening. Good evening, everyone.
And thanks for being with us today on this awareness drive. I'm sure taking out time from your busy schedule and joining us today, will obviously go a long way in, creating awareness around breast cancer, which is one of the leading cancers in India, especially when we talk about. So as a medical oncologist, my first question to you would be, for our audience, if you have to make them understand in a layman's term what actually is, breast cancer and how it develops, what are the bodily changes, that you experience, and we'll start with the background first.
Now, if I have to talk in the simplest possible term. Cancer means a abnormal and a fast, rapidly proliferating growth of the normal cells in the body. What happens when a cell starts growing faster than the cells surrounding it or besides it? Over a period of time, these cells form a lump, which is called as a swelling. So if I have to tell you in one word, what is breast cancer? Means a swelling in the breast, which is growing faster. Now, when I talk about this, why we need to know about breast cancer is more important, because this is a cancer which, if treated in a normal and in an early stage, is completely curable.
Right, Dr. Bharat. Very rightly you've pointed out how early detection can play a very important role in, in better health and treatment outcomes. But when we talk about early detection, because, screenings, we will come to that part also later. But if we talk about the early signs and symptoms, which can, nudge the person to go for those screenings, what would you say? What are the early signs and symptoms that women should be aware of in order to, detect some abnormal, change that they might have in their breasts?
The most common, as you have rightly said, the why we need to know more about breast cancer is because this is a cancer which we can detect early. So the most important person is the patient himself, herself. Now, a cancer basically means a swelling that I already told you. So a lady who has to basically, if there is a swelling in the breast, now in young patient also we can get a swelling. But as you grow older, you should not have any swelling in the breast. So if you have any swelling which is already present, which has started to grow, or any new swelling or a new lump that has appeared in the breast, this is the most common symptom that the patient manifests with. Rarely, the other symptoms are we can get a bloody discharge from the nipple. The other symptoms are related to that swelling, which includes pain or discomfort in the breast. Now, when the breast cancer grows and when it spreads to other organs, then the symptoms are different. Like, for example, when the breast tumor has spread in the lungs, it may cause symptoms like cough, breathing difficulty. Now, if it has gone in the liver, it can cause pain in the abdomen. Suppose if it has spread in the bone, it can cause back pain or a bony pain. And if it has spread in the brain, it may cause headache, it can cause vomiting, and rarely it can cause what we call as fits or seizures. So, early symptoms, swelling, and late symptoms are due to the spread of the cancer. Now, when we talk about signs in a cancer, the commonest sign is feeling of a lump in the breast. So normally in young ladies also we can get breast swelling, which we call as fibroadenoma. But when you feel a swelling is becoming harder, a swelling is becoming bigger, when you develop back pain, bone pains, and you feel if you press those areas and you feel tenderness, then these are all things to suggest that something is abnormal in a body. The commonest thing that I also missed was suppose you have loss of weight, loss of appetite, unexplained fever in a person who has a swelling in breast. So this could be attributable to the same disease.
Dr. Bharat. Coming to, we will be covering diagnosis and, of course, detection techniques in the later part of the discussion. But if we talk about the risk factors, because, there are many studies that suggest that some population are more prone to breast cancer. So, can you give us an insight on risk factors when we talk about breast cancer?
Now, for understanding the risk factor which leads to breast cancer, we need to understand there are two types. There are two basically the reasons why a lady developed a breast cancer. The first and the most common reason is a hormonal excess in the body. So that is called as hormone dependent tumor. In other words, a hyperestrogen state in the body. The second factor, which is equally important, is a hormone, what we say, independent factor. That is some mutations going on in the cell. Now, when we talk about hormone overactivity or hyperestrogenism, we need to understand what leads to increase in estrogen in a body, which is normal or apart from normal, what is the thing. So, early menarche, late menopause, use of estrogen containing medication in a postmenopausal lady, a nulliparous. So, childbirth is basically a protective thing. A nulliparous has high risk of developing a breast cancer, not feeding your baby. So, that also is a risk of breast cancer. Now, the other important thing, and probably which is the common reason why this cancer is increasing, is lifestyle. So, the two things contribute to lifestyle. The first thing which we say that is probably an effect of the what we say new age or is a obesity. So obesity is supposed to be something that which we have to be worried about because as suggested, obesity we have fats and fats are converted into oxygen free radicals that can cause damage to cells. So if you are obese, you are supposed to have a high risk of breast cancer, uterine or endometrial cancer, colon cancer. The other and the equally important risk factor are smoking, tobacco, alcohol. Apart from that, the other risk factor which we have to remember and which is equally important is the role of hereditary or familial history. So this is a common question being asked. Suppose if my mother, my sister, or one of my near relatives had breast cancer, can I develop a breast cancer? So, as per as the literature, it says that 10% or 1/10 of all breast cancer may have a hereditary or a familial incident. Here also there is an important thing that we talk about BRCA mutation because this came basically in prominence because if you remember Angelina Jolie, she did a bilateral mastectomy because she had this mutation, so she wanted to protect herself. So the third and the equally important thing is a genetic or a familial factor which leads to the development of cancer. So a hyperestrogen, familial factors, and the lifestyle. These are the three most important contributing factors which leads to development of breast cancer.
Right, Dr. Bharat. The preventive approach I'll also be touching upon in the later part of the discussion when we talk about preventive strategies and how modern lifestyle is playing a role, like you pointed out. Coming to diagnostic process. So, according to the staging, do you think that has an influence on and how? What are the basic tests that if you notice some abnormality in your breast, what are some of the tests that women can go for, and how does the stage influences those, diagnostic steps?
Now, when we talk about diagnostic procedures, the most important and the basic test, which is also included as a part of screening, is a mammogram. Now, mammogram is a special X-ray of the breast. Now, in a younger ladies, we do it by ultrasound. So, we less than 40, because of dense breast, we do it as a sonomammogram. After age 40, the best is going a digital mammogram. Now, this is for finding out if there is a swelling in the breast. Now, the other tests which are meant are for finding out whether this swelling has spread to other parts of the body. So, a basic X-ray chest and a ultrasonography of abdomen is what we do. Now, are there some special tests which we can do, or is some other test required? So if you have a higher risk of developing a hereditary breast cancer like BRCA associated, we do MRI breast, which has slightly better value. There is one more special test that is there, which is done or is advised to the patient when the cancer has become locally advanced. So here comes the role of what is locally advanced breast cancer. So breast cancer is divided or stage as 4 stages. If a tumor is less than 2 centimeter, it is stage 1. When the tumor goes beyond 2 centimeter, it becomes stage 2. Now, if the tumor involves the axilla or armpit, it is stage 2. And when there are multiple swellings in armpit, it becomes stage 3. When this swelling spreads to lung, liver, bone, brain, then it becomes stage 4. So any tumor which is more than 5 centimeter or there are multiple lymph nodes in axilla, the new test we do is called as PET scan, PET scan whole body, which is a test which can find out in one sitting has the cancer spread to other parts of body. Now, what is exciting is there is a new blood test available now, which can detect breast cancer in blood also. Now, seems exciting, and we should be proud that a Indian laboratory has discovered this test. And this test is called as Easy Check. So, what does it detect? It detects circulating tumor cells in the breast cancer, which has already spread in the blood. So, the new concept is before you see the swelling in the breast, there are microscopic tumor cells which are there in the blood, which is called as circulating tumor cells, which can be picked up by this special or a simple blood test. In fact, this test has been given an accelerated FDA approval, so that is a proud feeling. It needs a proper validated phase 3 study, but yes, a new test which can detect breast cancer through blood test only is also available to us. Voice.
Yes. So I was actually, coming to that part of my questions where I wanted to. You have already talked about how a simple blood test can now, detect breast cancer early. What are some of the other, treatment options if we talk about immunotherapy, or because now we are coming to more customized and tailored treatment options depending on the individual needs of the patient. So what are some of the, techniques, innovations which you feel will have a more, can show a very promising results in future in respect to breast cancer?
So when we have to divide the treatment of breast cancer is basically divided into treatment into 3 types: a surgical management, a radiotherapy, and a medical management. Now, when I talk about medical management of cancer, this treatment is divided into 4 types. So we have a cytotoxic chemotherapy, which we are using for ages. Then came and along with that, we have a hormonal therapy. As I have discussed this before you, 60% of breast cancer patients are hormonal dependent. So we have oral tablets which we give to stop or to reduce these hormones in the body. Now, the most exciting part of breast cancer treatment is development of targeted therapy or personalized therapy. Now, 20 to 30% of breast cancer patient has amplification of HER2 new receptor. These are epidermal growth factors. So these are special things which are present on the cell of the breast cancer patient. In 20 to 30% of breast cancer patients, these numbers, like a person who has two legs cells on the on two leg things on the cell of the breast cancer, these numbers are very high. Now, this is called as hello.
Yes, yes, we can hear you.
Sorry. So there are, so this is called as HER2 receptors. So this is a third type which is called as targeted therapy. Now comes the most exciting part of a treatment, that is called as immunotherapy. Now, immunotherapy is a concept which has taken up like anything. So it is called as, sorry, it is, I apologies for the interruption in
Yeah,
connection. Am
yeah.
I audible now?
Yes, yes, you're audible, but there is some issue with the connection, I guess.
So this, yeah, so the next part of it is called as immunotherapy. Need to understand basically what is this concept called as immunotherapy. We have immune cells in the body. These are T cells. Now, as we have infection in the body, the T cells kills those infectious cells. Now, a cancer is also not a normal thing. So why is that T cells not able to kill tumor cells? So the basic concept is like in a house we have keepers, or so these are brakes applied to the immune system which prevents this immune system from killing tumor cells. So now we have medications which if given removes these brakes from the T cells. T cells are able to kill tumor cells. On this seminal discovery, there was a Nobel Prize awarded in physiology in 2018. So we call it as one of the most significant milestone in the management of breast cancer. Now, in a triple negative, one of the types of breast cancer, this type of treatment works very well. In fact, this treatment now we are giving before surgery also to make more people get cured by this deadly cancer. The other important and the exciting data is a molecular testing of the breast cancer. Now, as a medical oncologist, the worst thing that people say is they are fearful about chemotherapy. So now I have special tests available with us, which I do in a hormone receptor positive breast cancer. 50 to 70% I can avoid chemotherapy in early CA breast. Looks exciting. If I can reduce the treatment, give them some oral tablet, they'll be more happier. Now, the second important again thing is I feel happy is in a stage 4 cancer, which is not curable, with these new tablets given along with hormonal, the survival of these cancers are increasing tremendously. In fact, even in last stage, we have so many patients who survive for 5, 8, 10 years. The thing I want to stress is give positivity, test for the appropriate thing. If you get positive, give them the best treatment, and God willing, everything falls in place. They may live for many years. A majority of them can be cured if it is in early stage.
Yes, Dr. Bharat very rightly pointed out that, the earlier it is detected, the better it is. And of course, having that positive attitude does work wonders for people. Coming to, because you have touched upon how, people do not want to go for chemo. There are a lot of myths because in India, we don't actually talk about issues like this. There is a kind of stigma that we see attached. So what are some of the myths that in your practice you have seen people, because I have heard nahi biopsy nahi karani usse aur phail jata hai cancer, things like that. So what are some of the myths that you would want to, because that would help our audience to know कि नहीं, coming from an expert like you, it would really help if you could talk about some of those myths and misconceptions that people have when it comes to breast cancer.
First, let me appreciate the thing that you have put in. There are so many myths actually out there, and probably this is the right platform for me to clear those myths. The first and the foremost that I have already spoken about it is, should biopsy be done or not? So please remember and make sure, and I can say with full confidence and 100%, is the biopsy will never cause the cancer to spread. In fact, biopsy is such a simple procedure. Just you put a needle, take out a small piece of tissue, and test it in a laboratory to find out whether it was really a cancer, and if it was a cancer, what was the type of breast cancer. The second thing is that you should not touch the tissue, what you said earlier, because it causes the cancer to spread. Again, this notion is not there. Third thing is, suppose if I had a breast cancer, or a lady, the other people of the family, like a sister, daughter, a young or the relative will develop it. Again, it develop in some of the relative, not in all. So does cancer run always in family? The answer is no. It may come, but yes, we have to be more vigilant. Now, the third thing is, because I am a medical oncologist, chemotherapy, red chemo cause side effect, but we have millions of I can, and where you give a treatment, the disease can, which may have more side effect. But yes, now we have trying to modify that. Like initially or before, we used to give a 3 weekly chemo. Now, if the patient is old, may not be fit, we make side effect of patient. The other heartening thing is that we have, so the side effects of tablets are minimal, more and more patients are able to take it. The third thing is about radiation also. Radiation may cause burning the skin. Please remember, like advanced radiation technique where the like a normal may not receive the radiation, only the organ of interest they so the side effects are also minimized. So many myths now. Please remember, all these myths are false. Whenever you have doubt, please consult an expert medical practitioner or even your family doctors, because now is the age of science and most of these myths have already been proven as wrong. So please remember, any myths, please don't have any myths. This is a safe treatment, very effective treatment, highly curable treatment, and majority of the people will tolerate this treatment better.
Dr. Bharat, coming to the counseling and psychosocial support, because most of the patients at that stage would be needing, and especially caregivers also, their caregivers would be needing counseling. So you think counseling is an integral part of the overall holistic cancer management? And as an oncologist, how do you, I mean, there might be patients who feel after the diagnosis they may be going through a low phase in their life. So what are some of the things that, as as an oncologist, you ensure that the patient is in the best of mental health as well?
Rightly put by you. I think so. The most important aspect, apart from is the counseling. Now, a cancer means a death warrant. Please remember, majority of cancers are curable. From the day one only, when the cancer is being used. Now, the first thing we need to put it a positive aspect. We re-emphasize, emphasize, and re-emphasize. Are you able to hear me, ma'am? Am I audible?
Yes, sir. There was the voice was breaking
Am
in
I
between.
audible now?
Yes, now you're audible.
So, as I said, is the most important part of management of cancer is to giving a positive look to the patient. Please remember, cancer is curable if detected early. So, the first thing that you have to tell or we have to make them understand is cancer is not such an uncommon thing now. In fact, breast cancer, if I tell you, of all cancers in the female, 1/4 are breast cancer. So, and a commonest cancer in the world, the commonest cancer in India. So, developing cancer, there is no problem. Anybody can develop a cancer. Most importantly, the counseling should be that we have to maintain a positive attitude with the treatments available. Most of the cancers are curable. So a proper positive look to be given to the patient, need to be encouraged that a periodic checking has to be done. They should visit a doctor regularly to take the proper treatment. They should follow up regularly and they should take care of the body well. There comes the role of caregivers also. So the family members are equally important. Need them to understand that a positive outlook or a positive advice to the patient goes in a long way to cheer him up. So, as I always say, is cancer is a team approach. Management of cancer, you require a doctor, but the important thing is a caregiver. They have to be equally positive and they should give a positive look to the patient. So, counseling, positivity, taking care, a coordination, communication should be emphasized to make this treatment. First, they should be taking the treatment and to make it successful because ultimately we are trying to cure a patient.
Right, Dr. Bharat. So, coming to the preventive approach, because you touched upon it, how lifestyle changes is a major factor that is, one of the reason why the numbers are increasing. So, what are some of the, and you talked about obesity also in that respect. So, what are some of the changes that, people can take in their daily lives, small steps that can go a long way in, ensuring a healthy body, not only about cancer prevention as a cancer prevention step, but also for the well-being of their body, maintaining their weight. And so, what are some of the steps that you would want to recommend our audience?
Excellent, excellent. Actually, some of the things that you are speaking, so it is making my job easy. So when I talk about prevention in a breast cancer, need to remember a triad. When I say triad means three things are important. The first part of a thing is weight. So you already illustrated that we have to maintain a proper weight. Now, again, the thing is everybody says that a proper weight. So what is your proper weight? So the answer is very simple. Height in centimeter. So you say 160. So your ideal weight is 60. So height in centimeter minus 100 is your ideal weight. If you are a 61, if your height is 5.5, which is 162.5, your ideal weight is 62.5. Anything which is beyond 62.5, yes, you are, that is beyond. Anything which is more than 10 kgs beyond what I say becomes then it goes towards obesity. There is other formula called as body mass index. Rather than going into detail, it is something that we need to remember. So, maintaining a proper weight, the first part of a triad. Now, again, I think how do you maintain a proper weight? Then again, it comes the role of the second activity, which is called as physical activity. Now, $1 million question. What is the ideal physical activity? So when you look into the American Heart Association, 150 minutes of a moderate physical activity in a week. So it means a brisk walking, 30 minutes a day for 5 days a week, or 75 minutes of rigorous physical activity. So swimming, jogging, cycling, Zumba, these all are considered as strenuous or a thing. So 15 minutes every day. This is what we say 5 days a week. So definitely. And the third and the equally important part of this triad is what you eat in your food. Now, lot of controversy where we should not eat junk food, agreed. We should not take lot of refrigerated food. Remember one thing, nothing of that sort has been definitely proven to cause simply a breast cancer. But yes, it contributes to it also. So the best part is all sorts of food, vegetarian, non-vegetarian, fruits, green leafy vegetables should be used in a proper proportion. You have to take all the things in a proper proportion. Nobody can say, "Fir bhi one fourth, one fourth, one fourth, one fourth." So fresh green leafy vegetable, lots of fruits, along with non-vegetarian food. Enough, you have to exercise properly and you have to maintain a normal weight. These are some of the things that we can do at our level to reduce the incidence of breast cancer. But I always say prevention you can always do, and yes, but you have to take care and you have to be vigilant about anything which is abnormal. So equally important, yes, prevention is also there, but we have to be knowing the symptoms and we have to go to a doctor as
Bharat, yes. Very, in a very simple terms, you explained about the importance of prevention, and I'm sure that our audience today will take a lot of relevant information on that. And thanks for being a part of this session with us, taking out time from your busy schedule and joining us today for this session, which was an initiative of IHW Council and Rapid Global Cancer Alliance and supported by Roche. Thanks to Dr. Bharat A. Vaswani for joining us, and thanks for being with us, Dr. Bharat.
thank you. Thank you again for a kind invitation. Thank you, everyone.
And
Good
I'm
night.
sure that our audience will, create a lot of awareness on prevention, management, and early detection of breast cancer. That's all for today. I would request all our audience to keep on following our social media for more updated information on health and well-being. Thank you, Dr. Bharat.
Thank you.